Telemedicine, simply put, is the practice of medicine from a distance. In other words, it's the mechanism that allows a patient to connect with a medical professional remotely for medical advice. And so typically it happens via, a smartphone or a computer or a tablet, and the communication style can be via text, audio, or video.
What services are recommended for telemedicine? Because clearly they cannot do everything, right? Like surgeries cannot be done.
Telemedicine is suitable for, urgent care situations, minor illnesses like fever, asthma, chronic disease monitoring of patients. Those type of situations can be handled via telemedicine. However, so if you are in a situation that requires the patient to come to the hospital for a physical examination, telemedicine clearly cannot really do the job. So there are some limitations to it, but the technology is evolving.
Talk to us about how readily available it is on the continent of Africa, because some people are still not very familiar with this.
Well, telemedicine is not new in Africa. Wherever you go in Africa, you would find some form of telemedicine project, but it's been largely pilot projects, small, islands of experiments that have been sort of deployed, but not at scale. But I think recently you've seen in the recent years some countries really taking telemedicine as an essential part of their healthcare sort of strategy. A great example is Rwanda, which actually has a nationwide telemedicine service today. And more countries are looking at telemedicine as essential in strengthening their healthcare system.
How can this strengthen African health systems as a whole?
In many African countries where mostly half the population lives in rural areas, right? So what happens is that in many health facilities in rural areas, there's no resident doctor, right? And so you have an increase in chronic diseases like diabetes, hypertension, cardiovascular diseases. Typically what happens in those areas is that, they largely go untreated because there's no local physician to take care of those patients. So now with telemedicine, essentially what you can do is provide means for residents in those remote locations via a telemedicine system to connect with a physician or a specialist remotely in larger cities. In that way, you can actually provide access to quality care, specialty care to populations which otherwise don't have access.
In some villages, some rural areas, there is no electricity, for example. Also, the access to technology may not be there, and it's not just an African issue. When you go to rural areas around the world, these challenges are there. So how do you tackle this?
I think as an individual, or maybe as a private player, it's difficult to change those things because these are systemic issues. And I think that has to come from the top. The country has to have some, governance in defining sort of a new strategy for ensuring that, all areas of the country have the necessary resources, and that includes electricity, that includes communication systems.
And finally, your company's mission is to transform how people access healthcare in Africa across the continent. How so?
So we provide a downloadable smartphone app, which is accessible to the population. And if you have a cell phone, you should be able to have access to a doctor. Through our application, patients can actually have access to doctors and set up a consultation with them, regardless of the location, and be able to be advised medically when they have an issue. So that's in a nutshell what we do. Obviously, with the pandemic, everyone is actually recommended to stay at home as much as possible. And also, as hospitals welcome patients with COVID-19, it's not always a good idea for patients to go to the hospitals because they might be exposed to the virus. The same thing applies to doctors. Here we have cases of doctors, succumbing to COVID-19. And as you may know, in Africa, there's a dire shortage of physicians. So Africa cannot afford to lose physicians, to COVID-19. So how telehealth or telemedicine helps in this process is that it enables patients to stay home and be connected with doctors in the comfort of their home and also in the safety of their home, and so that the doctors can determine whether or not they should come to the hospital, so based on their situation.
And Yaya Mbaoua, thank you so much for joining us today.
Thanks for having me. It's been a pleasure.